Hello and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbier Sayan. Thank you, as always, for taking the time to join me here to learn and to grow and to help support the profession. I'm always truly so grateful for all the support, all the likes, the shares, the comments, all the reviews, everything that everybody's been doing. As always, I'm trying to bring on amazing guests to help us learn more about the profession, to grow, to kind of move the profession forward. And today's guest is no exception. In fact, I'm truly honored to have Dr. Stanley Woo on the podcast today. And if you don't know Dr. Stanley Woo, he is the director of the School of Optometry and Vision Science at the University of Waterloo. That is the only English-speaking optometry school in Canada. So obviously have a very large presence in the industry, in the profession of optometry here in Canada. So I'm very honored to have you, Dr. Woo. Thank you so much for joining me.
Thank you very much for the opportunity. It's certainly a pleasure to be here, and appreciate all the great work that you're doing to promote awareness and educate through your podcast. So it's an honor to be here as well. Thank you so much.
Oh, thank you. It's very kind. Dr. Woo, before we jump into it, I'd love for you to give us a little bit of a self-intro, if you don't mind. What does your title include? What's your position at the University of Waterloo?
Yes, thank you. As director of the School of Optometry Vision Science, we lead sort of the school mission, vision, values, and certainly the multiple missions that we have there. Our talented faculty, staff, and students, obviously we have a big presence in delivering patient care. We're also responsible for clinical education and training for the contemporary practice of optometry. And then last but not least, being able to do innovative research from cell to society, to be able to encompass new techniques, new technologies, and research that we can translate into practice to improve health outcomes. So it really covers the gamut, and I'm fortunate to sort of be the spokesperson, if you will, for all the great people back home.
That's amazing. That's a lot of stuff. And you definitely are a great spokesperson. I think maybe I want to quickly throw this in there as well before we jump into it. But, I've heard you speak multiple times. You come to BC to the conference every year to kind of share, what's happening, what's new at Waterloo. And of course, to kind of get, remind everybody that this is the, preeminent sort of institute in Canada, especially on the research side as well. And it's always fun to hear you talk because you're always entertaining. You're always very, what's the right word? Charismatic on stage. So that's part of the reason why I was excited to have you on as well. I knew you'd be a good guest just from that side of things also. But we'll dig a little bit more into that stuff at the end or towards the end of the podcast. The research side is interesting to me. I think that's a side that perhaps, we don't think about enough, and how important that really is to our profession. So we'll get into that. But to really set the stage, one of the reasons I was so excited to have you on, and it's on the banner, if anybody's watching on YouTube or wherever, you see the banner here, The Future of Canadian Optometry. If you've been listening to the podcast over the last year or so, I've had multiple conversations now with guests to talk about the future of Canadian optometry. What is the future of the profession? What is the presence of certain entities in the profession mean? What does the education look like? What is the training for students coming out of school look like? What do we expect the future to look like for our profession? Is it bright? Is it dim? Is it positive? Is it negative? And what better person to have this conversation than the director of the university here in Canada, to, the person who's kind of leading the educational programs for the new graduates. So I wanted to really dig into this type of conversation with you, Dr. Woo. And the first question, to keep it really consistent, that I've asked every guest now, there's 7 previous episodes. This is the 8th in this vein here of the future of Canadian optometry. The first question I've asked every guest is, in your opinion, what is the current state of optometry in Canada?
It's an excellent question, and certainly it's a challenging one. So there's not a very simple answer. I think that we are at a bit of a crossroads in Canada. So optometry as a profession, we're well positioned to assume a primary care role to address the growing eye and vision care needs of an aging population. But by the same token, we oftentimes fall outside of the priorities for health systems. And so remuneration has lagged significantly behind the level of education, skill, and training that we are able to bring into play. So I think that those challenges put us in a position where there is great opportunity, but there are also challenges to be better recognized within the system and how we can help to improve access while also being appropriately remunerated.
I would definitely agree on that crossroads, and there's good and bad in there. Of course, we have to look at how we're always going to progress. How do you, in your opinion, then, how do you see us improving that, the remuneration and then the recognition within the healthcare system?
I think one of the pivotal areas is to really be able to raise awareness. So public education of both, potential patients and communities, but also with government, to be able to highlight that there is in fact a public health crisis, if you will, in vision care. It's often taken for granted and sort of at the margins. And yet we do recognize with various organizations, the evidence is there to point out that in fact it is something that needs to be urgently addressed.
Hmm.
In this case, the World Health Organization in 2019 pushed out its first vision report ever, and it highlighted there are over 2.2 billion people with vision loss, almost half of which could be preventable. And while we might think that the World Health Organization is really only addressing issues that are sort of abroad and where there might be less well-developed infrastructure, in point of fact, a lot of the challenges that they identified also face us right here at home. And so we recognize that there is a tremendous number of Canadians who are at risk for vision loss. Not everybody recognizes the ability or the need to be able to get comprehensive eye examinations to address it. And the economic impact is projected to be about $56 billion by 2015, as far as the annual cost of vision loss. And it's currently at about $33 billion. So there's an urgent need to raise awareness to be able to drive, again, the recognition that it is a challenge that could and should be addressed. That we need to be thoughtful and strategic in how we organize ourselves in being able to meet this challenge, both as individual optometrists in our own communities, but also through our provincial associations and colleges, and of course the National Association as well. One of the things that makes it somewhat optimistic is that there is a little bit greater awareness. There's a private member bill by MP Judy Sgro for C-284 calling for a national vision care strategy. And so there is, again, growing awareness that we oftentimes take our sight for granted, but those who've been touched by vision loss, and if you live long enough, everybody will have some experience with impaired vision. It's important to really recognize that early diagnosis, intervention, management, treatment are critical to really being able to maximize everybody's independence, quality of life, and the like.
One of the conversations or one of the questions that's come up, or comes up quite a lot, is the scope of practice. And whether or not, it's important for us to continue pushing to grow or expand that scope of practice. First, I think I kind of know your answer on this, but, where do you sit on as far as expanding scope of practice? And then how do we go about doing that?
So I think scope of practice is something that every health profession continues to expand and drive, right? We always want to be able to incorporate new technology, new treatments, accelerate that translation into practice so we can take the best possible care of our patients. And so scope of practice isn't something that should be, limited or constrained. It really should be something that we promote and accelerate in order to be able to really leverage the rapid pace of technology and treatments available. I think the other challenge is that, we recognize that, North America has probably the most well-developed optometry profession and programs in both education and research. That we really lead the way as far as being able to be primary eye care providers and really address particularly medical eye care needs. As I said before, it's a challenging problem. We have an aging population, medical eye disease like age-related macular degeneration, glaucoma, diabetic retinopathy. These are all things that optometry is well positioned to be able to incorporate and adapt to. In point of fact, some of the scope of practice, it's a bit frustrating because things like, technologies like lasers for glaucoma have been around for decades. They've been successfully deployed by optometrists in Oklahoma, for example, for over 20 years, successfully, safely, and with improved access to patients and to be able to get better care, better outcomes. And it is challenging that it's taken so long to do what seems to be so self-evidently beneficial to the public, to the health system, and ultimately to individual patients in remote communities that may not have access to care. So scope of practice is really, really critical. It's important to recognize that the school has a responsibility to be able to deliver that contemporary education in order to enable all of our graduates to practice at the highest level of scope available. And to also support those in the profession with continuing professional development to be able to have access to that education, skills, and training so that they can obviously deploy that into their communities as well. By working together closely with associations for their advocacy efforts, with the colleges, with their duty to protect the public, And with the school providing the educational foundation, I think that having that collaboration amongst all three sort of entities enables us to really put together the evidence and be able to demonstrate, particularly the government, that it is imperative that optometrists are recognized for their full capabilities to be able to help meet that growing demand, help to relieve stress on the health system, and ultimately really to be able to look after folks in community where they reside, where again, closer to home, if you will.
Yeah. I would say that's one of the more common frustrations, I, myself included. Now, it's been a while since I graduated, but even, of course, now with newer grads who are studying, whether it's in Canada or in the States, coming back home and realizing that a good chunk of your medical training that you have is not really valuable or applicable because our scope of practice is fairly narrow compared to the level of education. What do you think has been the main obstacle, over the past couple of decades, however long it's been since, we've been trained to a certain level, but not able to actually practice to the same level?
So I think a few things there. First off, is that we really want to be able to educate to the highest level, and that hopefully that creates a passion, a desire, a sense of initiative, where new grads will want to press to say, why can't we do what we've been trained to do? Why can't we do the most that we can to support our patients and our community? And with that grassroots effort, then the hope is that that can help coordinate with, for example, provincial associations like the Alberta Association of Optometrists. So they have been particularly effective in being able to build the case. They are a large province, a very wide sort of geographic distribution. They have a very strong case for improving rural access to medical eye care. They've assembled the evidence, the education, the research, the impact. And so then it's really just a question of being able to say, okay, at what stage does this have to be implemented? Like, what is the holdup? And I think the frustration is oftentimes, it comes down to a balance of awareness, of really reviewing the evidence, and then not being afraid to institute change, right? So I think health systems and lots of systems are resistant to change. And oftentimes that disruption of the status quo can cause challenges. And I think in this case, yeah, it might be a little bit upsetting to some. But ultimately, if we put patients first and recognize that what's in their best interest is to be able to get accessible medical eye care, optometrists are extremely well positioned. We are in many more communities. There are many more of us than other eye care providers, and certainly the opportunity to again look after folks closer to home would be a benefit to those individuals in those communities. So not having to travel as great a distance, being able to get more convenient care, and then ultimately with the doctor that's already been looking after them. So I think it's a natural extension to be able to promote it. And I would say really the challenge is to just get that first province like Alberta to be able to say, what, it's overdue. And the time is absolutely now to help make this happen.
Yeah, definitely kudos to our colleagues in Alberta for leading the way, paving that path a little bit. We definitely look to them to see the progression they've made in serving their patients in different ways to prescribe and treat diseases that we're not able to in BC, at least, and I know other provinces are not yet, but we'll hopefully continue moving forward. I was chatting with our mutual friend, Dr. Richard Maharaj, and he gave me a quote from you that I was hoping you might expand on, which is education before legislation. Did I get that right?
That's absolutely correct.
And so is that essentially what you're talking about here, or is there more to that?
Yes, it's a common mantra. So, I spent over 2 decades down in the US, spent most of my academic career down there. And so had been involved with the American Optometric Association, our state association in Texas. And this was a common refrain. So when I was at the University of Houston, the College of Optometry there, we worked with the Texas Optometric Association. And the notion was that, okay, if the criticism from folks who are reticent or concerned is that there's not sufficient education for optometrists to be able to deliver this care safely and effectively, then we have to address that and provide that foundation, make sure that we educate before legislation, so before those changes are enacted to promote the opportunity. It does make good sense to make sure that that educational foundation is sound and that the folks are prepared and able to deliver competent care. So education before legislation resides sort of within the school, so that we deliver the content first to our students, but ultimately also to the profession. And we have an advanced procedures course that we have incorporated. So we've learned from our colleagues down in Oklahoma who've been doing this again for over 2 decades. And we've adapted it for the Canadian context. So our healthcare systems are different, some of the values are different. And so it's an opportunity to be able to, again, provide that education so that as associations go to their various legislatures, they can reassure those members that in fact we have addressed the safety concerns, we have addressed the efficacy concerns, and then ultimately it's an important change that can help to improve again the system. I think the other thing to consider also is that education before legislation now also reflects on educating both the public and those government officials. So we've been fortunate to have MPs and MPPs come to visit the school, because oftentimes their perception of what optometry is, where we are, where we've been, and where we've going is perhaps a bit limited or narrow. And being able to come and visit the school and see the facilities, see the imaging technology, being able to actually see and how we use lasers for YAG capsulotomies and SLT, it all of a sudden makes sense, because they go, oh, well, you use that slant biomicroscope every day, and now you put an energy source on there and you're still using the same technique. Okay, I guess that isn't as big a reach, and that the dangers and the things that we sort of manufacture in our minds about what that could mean and how it might be a threat to vision. In fact, now it sort of demystifies the whole thing. So education before legislation has 2 arms. One is for the profession and for students. The other is for government officials, so that they understand that this is actually both realistic, credible, defensible, and ultimately to the benefit of patients.
Yeah, wonderful. Speaking of the education of students, this is kind of a two-pronged question here. One is, what types of disruption do you feel you've seen or we should expect to see coming in the profession? And then 2, regarding the education of students, how does Waterloo or educational institutes in general prepare students for? Maybe I'll do it more specifically. How do you think Waterloo is addressing potential disruptions in the industry?
Yeah, an excellent question, Dr. Scan. I think one of the things that is really, I think, both exciting and also maybe a little anxiety laden is technology, right? The pace of technological development and how that impacts the way we practice is growing by leaps and bounds. And I think if we embrace that and help to shape it in a way that helps us do our jobs more efficiently and more effectively, then it can show great promise and potential. If, on the other hand, we're sort of resistant and we think that we can sort of delay or postpone it, then it creates that anxiety about, well, what is our role then, and how can we adapt? So one example is teleoptometry, for example. So within telehealth, telemedicine, optometry now is developing the technology that's at the cusp, if you will, of being able to deliver comprehensive remote eye examinations. And so on the one hand, that could be a very good thing. On the other, it might be disruptive and maybe even challenging. I think from a positive standpoint, the notion is that it could be leveraged to help deliver access to care for rural and remote communities, in particular Indigenous communities and First Nations, Inuit, and Métis. Now, it's not a panacea, it's not a cure-all, but I think that folks recognize that, again, in Canada, we have a big geographic distribution. Weather is challenging sometimes. And if teleoptometry technology can help us to improve year-round access and assist in the management of chronic eye disease, like glaucoma, that would definitely be a benefit. The flip side is that teleoptometry is not obviously limited to just those areas. It also can provide convenient care. So whether it's extended hours or shorter wait times, because it's a new modality, not everybody's comfortable with it. But for those who do, it sort of offers an alternative. And so being able to kind of reconcile where we want to be, what we want to do, how do we want to incorporate as a profession to benefit our patients, I think that's one example of a disruption that we're navigating right now. In order to address that for our students, obviously, we need to make the investment in infrastructure. So we're fortunate to have a teleoptometry lane that we've deployed so that we can start to understand how that works. And right now, our faculty team and graduate students are looking at that and trying to, again, get a better handle about how it works, what are the limitations, and ultimately how we might help support policymaking and guidance to make sure that it is used effectively to maintain the standard of care. I think the other technology that's quite disruptive, obviously, is AI. So we get to, the extremes where we have Skynet and Terminator and all those. Obviously, that's more sensationalized, but closer
Is
to
it
home.
though? Is it really?
Well, we hope so. I think that's for another podcast.
Yeah, exactly.
But AI, I view it as being something that can really be harnessed for clinical decision support. I don't see it as a replacement. I think that there is a really important role to play for optometrists in the doctor-patient relationship to really be able to counsel, educate, and guide patients through their journey as they seek healthcare, whether it's eye and vision care or beyond. There's a trusted relationship there and a connection. And while there may be some who, again, are happy with everything being remote and that kind of thing, I think there will always be an opportunity for AI to support the work that we do. Now, the challenge to that is that we also have to help shape how that unfolds, right? So I think we need to be able to look under the hood, if you will, and make sure that we understand how those algorithms are designed and built, that it's trustable, that it's explainable, and that ultimately it helps to support the work that we need to do, particularly in a primary care setting. So, for example, with ophthalmic imaging, optometrists have OCT, have fundus cameras, have all sorts of technology for ophthalmic imaging. It's important that we recognize and harness that resource to work collectively to then help shape how AI is developed to, again, as you can imagine, we're the ones who see folks before they develop eye disease. So if you're going to develop predictive models, it's not the end stage in identification, it's actually the things that are further upstream. And then that enables us to create the infrastructure, perhaps, with the school as a potential resource and partner to be able to now aggregate that information all across, address things like de-identification, privacy, cybersecurity, and the like, so that ultimately we can create a public good to help support the next level and next generation of innovation. So those are just two examples of some of the disruptions, and again, the role that we're trying to position the school at as a national resource to support both students, the profession, and ultimately the public.
Yeah, that's great. I think those are probably the two, the two types of technology and disruption that are kind of at the forefront of most people's minds. You mentioned that teleoptometry you felt was on the cusp. I've spoken to some people who feel it's beyond that. It's here and ready. Would you disagree?
No, I think on the cusp, I reference sort of the middle of the normal distribution, if you will. So there are definitely early adopters and who have been already implementing and doing it and doing a good job. I think there's still some gray areas as far as from a regulatory standpoint and an efficacy standpoint. But certainly that is, again, a charge to the two schools, both us and Montreal, to develop, again, the research protocols to find the evidence to support the efficacy and the effectiveness, and being able to look at it from both a patient experience and outcome lens, but also from a provider experience. So I think one of the things that we need to explore is what are the sort of the pain points for folks to adopt technology like teleoptometry. So rather than simply, leave it sort of in the gray area, it would be helpful to better understand, okay, when does it work well? When is it limited? And how do we address the various patient pathways so that we can make sure that at the end of the day, patients are looked after regardless of the technology or the tool that we use to implement it.
Yeah. And with the AI thing, the whole Skynet thing is half a joke. I also think about the movie I, Robot. I don't know if you remember seeing that one, but eventually the machines take over. But that is a real fear for many ODs, is that the machines will take over our jobs, not necessarily, control our world, maybe one day. But clearly I'm a bit of a conspiracy theorist. But there's a real fear that AI and the technology, virtual technology, will basically bump the OD out of the exam room entirely. Do you think that's a real concern?
It's always a concern, right? Because as the technology gets better and better, and patients and the public sort of choose their own pathway for how they want to seek and receive care, we have to be able to respond to that. And I think it's incumbent upon us to demonstrate our value to our patients, the public, to the government, about why it's important to have an optometrist be able to still be in the role of being able to interpret that data, being able to override the AI when it's incorrect, be able to recognize that there is a person behind all of the data that's gathered, and that ultimately, there's still a very human component to what's required in being able to, deliver the art and practice of optometry. And so, yeah, it's definitely, a potential threat. We've seen that disruption in all sorts of industries, manufacturing and the automotive industry. So we're not immune. I recognize that there is that challenge, but I see that as our opportunity to, again, harness that technology and make sure that we use it to be even better than we already are, and to recognize how it can make us more efficient, more effective, and ultimately deliver better care. So I prefer to see the glass half full, that we can benefit from it, that we shouldn't fear it. But if we adapt and we incorporate it into what we do, and we demonstrate the evidence to support our value and what we can deliver, then I'm confident that we can be even more effective. Again, there's lots and lots of folks who need care. There's lots and lots of folks who are unaware that they need care. And this can help us be able to help address that challenge.
Speaking of folks who need care, one of the common, well, it's come up enough times during these conversations about the future of optometry in Canada. And there's, certain groups that are more vocal about this particular point, particularly in Canada. There's not enough optometrists to meet the need of just the general public. First, do you agree that is the case? There's a shortage of optometrists, not enough optometrists in Canada.
My answers are more nuanced because I don't think it's an either or.
Mm-hmm.
So the way that I would reframe that question is based on where the need is. So let me start first with where I believe that there's a shortage, and that's with the number of primary eye care providers addressing the medical eye care needs of an aging population. So in that regard, there is for sure not enough optometrists, ophthalmologists to be able to meet the needs. Everybody has declared that, right? So I think that we need to make sure that the optometrists that we're graduating, the ones that are practicing, recognize that there are opportunities then to be able to meet that need, largely in rural and sometimes more remote communities, that they need to have folks out there who are able to address most things most of the time in order to be able to deliver good care, and to also help improve and relieve the burden on the system. So that would be one facet. So absolutely need more highly qualified optometrists ready to deliver the contemporary eye care. On the flip side, if you go to any big urban center or city, there's lots of optometrists there. And so in that sense, both the location, there's plenty of supply, but also if they limit their scope to more sort of traditional refractive needs, whether that's glasses or contacts, then arguably you probably have a saturation point, that there's probably sufficient options and choices where you wouldn't necessarily need to grow that segment of the industry. And so this is where, and this has been faced in the States as well, as they look at the increasing supply of optometrists and what the needs are. I think the take-home message would be that in Canada in particular, the medical eye care needs outstrip the supply of both optometrists and ophthalmologists, and that we need to continue to attract, recruit, and retain optometrists who are prepared to deliver full scope contemporary optometry.
So your feeling is that it's more of a geographic, what's the right word? Imbalance. I don't know. It's not the right word. Like poorly distributed supply of optometrists, right? We tend to, of course, in general, we tend to gather into those metropolitan centers, and the rural areas get less supply. Do you feel like that's primarily just the shortage then? Is just that certain areas just don't have enough primary eye care providers? It's not that there's a global shortage of optometrists.
I think in Canada, it's the combination, right? So I think it's easy to point to the rural access, the geographic distribution as one area of need. So we obviously need more practitioners out in those rural communities. But also within the cities, within those major urban centers, there are still wait times, there's still demands for medical eye care access. That there is an opportunity for folks to be able to carve out a different niche, if you will, right? And to recognize that particularly, the other aspect is growth within the services that are provided. So, the depth and breadth of optometry continues to expand. You mentioned Dr. Richard Maharaj earlier. So, dry eye in particular, myopia control, medical eye care management, vision therapy, low vision rehabilitation. There's a lot more that we can do now than we could 30 years ago. And I think that in that sense, there is a need for more folks, more practitioners, more optometrists to be able to deliver that sort of next level of care, and that there are folks who are happy to actually spend more time in those more specialized areas in order to be able to help meet that growing demand as well. So I think the notion overall, so if I had to say, do we have enough optometrists in Canada? My short answer would be no. And with the cautionary tale that we don't necessarily need everybody doing the same thing. I think what we need to recognize is that we need a better distribution, and we need to recognize that there are, again, more sort of specialized areas that there is growing demand, whether it's medical eye care or those others that I mentioned, that could absolutely be an opportunity for growth and, again, improved access. So I think we're at a good state right now for all of Canada. As you mentioned earlier, there's only 2 schools of optometry, ourselves here in Montreal, which is the French-speaking school. And so we also recognize that we have a lot of Canadians who are interested in optometry school. We unfortunately don't have enough seats for all of the qualified Canadians who are talented and obviously capable enough. And so unfortunately, they have to go down to the States or other areas or jurisdictions in order to be able to get that training and then ultimately return. So there's clearly demand as far as the number of students, and there's an opportunity for us to help to address that.
Perfect segue, because then the next part of that question and part of that conversation often is that, again, certain people are more vocal about this than others, but there's a need for more schools. Do you agree on that?
So I think that we had a strategic planning exercise a number of years ago, maybe 4 or 5 years ago. And one of the priorities that did emerge is to recognize that there are insufficient seats for the number of qualified Canadians who are interested in optometry school and ultimately practicing in the profession. So one of the things that I think that we had proposed that was a bit different than perhaps what's been done previously is that rather than trying to start up a new school from scratch, would be to actually work with the School of Optometry here at Waterloo, where we already have the expertise and the accreditation, to partner with another institution that has the infrastructure to deliver health professions education, and then to work collaboratively in a joint program where we would have a satellite campus of the School of Optometry at Waterloo at another location, ideally in a rural location. So you actually recruit from, I think the mantra is, recruit from the north for the north. So you make it more accessible to folks who might not want to come to Waterloo or go to a big city. It makes it more comfortable, more familiar, closer to home. And then leveraging technology now to be able to recognize that through COVID, we've learned a lot about hybrid education, that we're more comfortable with the technology, that we can achieve the same learning outcomes and ultimately use it to our advantage where it's appropriate and intentional. And that instead of somebody trying to create a school from scratch, which has happened from my knowledge, I grew up in Waterloo, every decade somebody decides they want to start a school. But the limitations are threefold. One is you have to have local optometry support. Those docs locally are the ones who are oftentimes going to be the clinical preceptors to help support the clinical education training. And they have to recognize that there is both a greater good and a need, because it's been proven that, optometry schools, that people end up connecting and settling down. And so they may start to gravitate and create an oversupply in their sort of that region. And so optometrists have to recognize that, okay, we have a shortage, so we want that, and we want to recruit more folks from those communities, and it's okay that they stay. The other one, so local OD support is one aspect. The second aspect is government. The government has to be able to recognize that there's a need, that there's a workforce shortage to meet, again, healthcare priorities like medical eye care, and to be willing to make the investment. So tuition and grant has continued to sort of be either flat or regress over the years. This is in every province, is my understanding. And so with tuition and grant insufficient to match the costs of delivering clinical education and training, there has to be a willingness to make that investment. So if you can set tuition and grant right, if you can get local OD support, The next part then is to make sure that you have an accredited program that has the quality that the public deserves and needs in order to meet that demand. And this is where the School of Optometry at Waterloo could be a valuable partner, because we have that know-how, we have that accreditation, we have that experience and expertise. And by then lending that to a partner and working together collaboratively to co-design what the curriculum could look like, both the didactic, the laboratory, and the clinical education training, we could create that infrastructure in that partnership. So it really is those three components. You have to have, again, local support from the optometrists, government, so that the economics make sense, and ultimately a guarantor for the accreditation and quality of the education that's being delivered. Again, we don't need more folks practicing at all sorts of different levels. What we need are more graduates practicing to the full scope of optometry with a fire in their belly to go and make that happen so that they can do what they're trained to do.
That last piece there, the accreditation and quality of training, is certainly something that's been part of the discussion as well over this past year or so that I've been having these conversations. There's been rumblings in other countries where perhaps to try to meet the need, air quotes for people who are not watching here, to meet the need, perhaps there needs to be a change in the level of the training. Perhaps we can train people at different, maybe the equivalent would be sort of the nurse practitioner next to the MD, some sort of equivalent in the OD space. That way that more people can have that need met. Do you feel, is that ever going to be a possibility? Maybe not ever. Is that anywhere on the horizon for Canada? And how would we potentially avoid that if you think that's probably a negative move in the wrong direction?
It's an interesting challenge, right? Because on the one hand, we want to be able to promote access, but on the other hand, we already have a public that is not always aware of what eye care is and what's important about it. And so, given that we have folks who, for example, children oftentimes have coverage for a comprehensive eye examination, but kids are resilient. And so, not every kid gets an eye exam, even though they're eligible and it's covered. I mean, it's fantastic that that benefit is available, but the fact that folks don't take their kids in, and whether it's awareness, education, or it's just other access problems like transportation and others, it's a complex question. But I think the challenge is that if the public is already struggling with the value of getting an eye exam and then understanding the difference between screenings and comprehensive eye examinations, the last thing we need to do is to cannibalize the profession where you have different levels and different tiers. You don't want, some optometrists doing one thing that's not primary care and some others doing a different level without it being clear to the public. And so advanced practice type stuff, so specialization, that's different. But the core is primary eye care. We have to have a common fundamental foundation, because that is the entry point, if you will. That's why it's primary care. Folks need to know that when they go see an optometrist, they're going to get this level of care, not maybe this, maybe that, maybe something lower. They need to understand that this is the place to get a comprehensive eye examination for early diagnosis, prevention, treatment, wellness, all the way through the diagnosis, management, and treatment of disease. And there's a struggle there. And so when you allow these different levels, it makes it more confusing in a situation that's already challenging. And so I would go the other direction and really want to work with government, public health, those kinds of agencies to be able to just get a comprehensive eye examination, because it is essential to being able to see clearly and comfortably, particularly children who aren't necessarily going to complain. They're going to just adapt. And if they can't see clearly, they'll work around it. And I know many folks who come and, they've seen, like, the first time they go, I had no idea my kid couldn't see the board or couldn't see this or that. And it's really a shame, because there is no reason why they couldn't. And sometimes they're very affluent, very professional. It's not top of mind. And so I really push back against this notion of either watering down or allowing different aspects, because I think that if we are committed to being able to do it, we're willing to make the investment, we can elevate the expectation and that access without compromising the quality of care. And I think that's what Canadians expect and deserve. That's why we all support each other with the health system. And I think that's the commitment that we make as a profession.
Going back to kind of that conversation about it being a shortage, there does seem to be, even in like, our offices are in, fairly busy sort of metropolitan areas. And even I've felt, as the owner of two offices, like a difficulty in recruiting ODs. Not sure if there's like a real shortage or if it's one of those like COVID related things where people are just wanting to work less. Whatever the case is, there just does seem to be a demand for ODs these days. And, with that, then there's certain entities within the industry that are offering incentives to then recruit ODs, right? And of course, some large entities have more power to do that. They'll give loans, or they'll pay larger salaries or signing bonuses and things like that. You're the head of this institution that's grooming these graduates and these students to come out into the world, into the profession. From that perspective, you feel like these incentives are a good thing? Like the students are coming out of school like, yeah, I can pay off my debt like this, and I'm gonna jump into the profession a lot faster. Or do you think perhaps it's somehow clouding their judgment a little bit into the way they're practicing? Perhaps on one end here you are trying to train them to the highest level, but perhaps they're taking jobs that are not in line with that because they're just going for the money.
Student debt is a real concern. Whether you go to a Canadian school or a US school, it limits options, it limits opportunities, it delays plans, whether that's, buying a house, starting a family, or, becoming a pathway for ownership or partnership in a practice. So I think they're first and foremost, we need to recognize that is a real pressure on new graduates in particular, and understandably will help to shape the choices that they make. I think that there is an important vehicle to be able to help, offset some of that student debt. I think that there are some sort of virtuous ways to be able to do that. Where programs where, you can incentivize folks, for example, to practice in areas that are underserved. There have programs like that in the States. You get 1 year loan forgiveness for 1 year of service in underserved community, for example. And that's a win-win, right? That would be something that I think would be helpful for government in particular to be able to help incentivize new grads to practice in communities that don't have as regular or effective access. So that would be a positive. And so I don't want to mislabel, relief of student debt as a bad thing only.
Mm-hmm.
To your point, though, does it unduly influence students and new grads in a pathway that may not necessarily be best in the long term? I have a tremendous amount of respect for all optometrists and optometry graduates. I think they're very smart. I think that they are very capable. But they need to be encouraged to ask the right questions, to seek out the right resources, and ultimately not fall into the trap that so many of us do, where we think that we're so smart that we don't need to get help. So in particular, whether that's accountants or lawyers or the like, yes, coming out with student debt, you're trying to save money and you think maybe I could just do this on my own. I think my advice there would be, if it sounds too good to be true, maybe it is too good to be true, but get professional advice to help you make those determinations, to ask the questions, to see what the fine print really means, and to ultimately make sure that it matches both your short-term needs and also your long-term desires for the profession. Because new grads are in it for the rest of their life, their professional careers. And I think the challenge is that you don't want to sacrifice, no matter how painful that short term is, in order to maybe not make your future opportunities quite as promising. And it's tough. It's a big sacrifice that we're asking folks to make. We all make it when we graduate. We have to make those trade-offs. So ultimately, I don't think we begrudge anybody for those choices. But I think at the end of the day, it's about making an informed choice, making an objective and not necessarily emotional one, and really being able to make an informed one based on all the evidence and the answers to all the questions, I think, that are most critical to have addressed. Most important being, how do you want to practice? What does that look like? And is that going to be sustainable for you in the future?
I think that's one of the key takeaways from that is making sure you ask the right questions at every step of the way, whether it's of other optometrists or, like you said, from other professionals who will be involved in financially or whatever interaction it might be. I think that's always so important. I do say, the pun intended here, I do always feel like, a lot of our colleagues or new grads, whoever it might be, could be a little myopic with just seeing like what's right in front of you and not seeing what's the long-term impact on your own career or the profession as a whole. You know, if a majority of our colleagues are choosing a certain path, it's going to lead ultimately to the public and to the government seeing that, well, a lot of optometrists seem to just practice like this, then maybe we don't need to expand the scope. Maybe we just need to keep it to just this. You know, but if more of us are looking at how are we going to grow the profession and grow the scope of practice by actually doing those more specialized types of things, then the public and the government and everybody else will see, okay, it looks like optometrists do a lot of different things. Maybe we do need to give them what they're looking for. And that's a much broader view that I'm hoping that more of us will have, so our profession does continue to thrive. You know, I assume you agree with that to some degree. But trying to do that in the most politically correct way without calling out too many people and demeaning or making anyone feel bad. But I think it's really important that we do try to see things in the larger perspective.
Absolutely. I think that being able to see the big picture and our role in it is really important. And it's not necessarily the default. And I get that, right? You've got real pressures that you're having to address.
Mm.
You know, the other groups that I would sort of give a shout out to help with that broader perspective for new grads in particular are those, their provincial associations, right?
Yeah.
They understand what the different challenges are, what the current state is, how, what the tools and resources are to make that transition from, student into practice. And they are ready, willing, and able to help support, new grads in being able to be successful. And I think that they're an important resource. The other would be the college, because I think the college can help provide guidance on what the rights, responsibilities, and duties are in each jurisdiction for each optometrist. And so, being aware of what you can and can't do, no matter what other folks are telling you, it's important to know what, both what your rights are, but also your responsibilities, because you don't want to inadvertently abdicate some of that, because at the end of the day, you still have to be able to answer for, again, the professional standards to which we all subscribe. So I would encourage folks to be able to look to those two sort of organizations in each province, because they do help provide that context, like that big picture, and to be able to see where things land. And I guess the last point there is to emphasize, we really want folks graduating where they're hungry to do everything that they're trained to do. Like, we want them to go, I am frustrated. I don't understand why I can't do an SLT to help my patient for glaucoma. It makes sense. I'm confident, capable, and ready to do it, and be able to be that agent for change, right? Like, we want new grads to be the ones who are going out there saying, how come this can't get done? What can I do to help? How do I make sure that I can educate before legislation, and making sure that my patients who deserve the best possible care from me can actually get it?
So before I want to talk about the Seeing Beyond 2020 campaign, but any other thoughts on this, the future of Canadian optometry, where you think we're going, and how we can make sure you do our part to make sure the profession thrives in the future?
It's wonderful to be able to look forward, right? I love the tagline at the top, the future of Canadian optometry. I'm really optimistic. I think that there's lots of interesting things to be able to do. With that sort of entry, one of the things that we haven't talked about in depth, but I think are worth expanding again, is the depth and breadth of optometry. So there is increasing sort of critical mass in specializations. And while we're not able to designate that for various reasons in different jurisdictions, largely because of marketing and advertising, I think that there's a growing awareness that, you can limit your practice to specific areas and do it very well, that you spend additional time and training, that you see more and more complex patients in that space, and that ultimately it's beneficial for both, our colleagues who may be doing primary care and not low vision rehabilitation as a specialty, for example, because that is, again, to do that takes time, energy, and expertise, and that can be cultivated and developed, and that ultimately patients benefit by not being limited then to what we think is the limit of what we're able to do, but rather working collaboratively together. All of that is to say that there's a group called the Canadian College of Specialties in Optometry. sort of spearheaded by Alberta, but also working closely with FORAC, which is the National Association of the regulatory bodies of all the provincial colleges, to be able to recognize that, there is some benefit to the public to know who might be in those different areas, that who might have had the additional training and education and credentialing, and recognizing that it's not all just about school and education. There is a great deal of clinical wisdom and experience that is brought to bear as well. But the CCSO is working to try to create that framework and a pathway for the Canadian context again, being able to help support both the regulators and the profession in having a reasonable, sort of attainable, credible, and defensible path to being able to recognize specialties. And they're doing some good work. In full disclosure, I'm one of the directors there. So again, very interested in being able to engage with the profession to help address, any pain points or concerns, but ultimately to help promote that credentialing as a benefit to the public and also to the profession, that we start to understand who might be able to do those kinds of things in a way that we expect to, that would maintain that standard and quality that we expect.
Yeah, that's an excellent initiative. And actually, going back to Rich again, he mentioned it. So the last episode I did on this topic, the future of Canadian optometry, was with Dr. Maharaj, and he mentioned that, of course, himself being one of those ODs has really spent time to specialize. And I know he was, one of the pain points he was talking about was the fact that you can't call yourself a specialist in any particular area. But even though you've done all the training and you are specialized beyond what the majority of the profession is, but this is a great initiative to kind of hopefully eventually provide that ability for us to say, yes, I'm specialized in this area, and encourage the specialization. I think is very important. Before I say the next thing I'm going to say, I do want to say, just if you can't find the website, Google it. Canadian College of Specialties in Optometry. It'll show up right away. In fact, Google actually filled that in for me. I just started typing Canadian College of Specialties and it came up. So it's coming up. But the website also is, I'll try to put it in the notes here so everyone can see it if you go up on the podcast app, but ccso-ccso.ca, and that'll take you to the homepage there. Yeah, sorry, go ahead.
Let me just also add that this is another example of sort of education before legislation. So I think there are two provincial colleges that are able to make the change and say, yes, we can, and recognize specialists. The majority would require a legislative change. So that obviously is more complex. It would, have a lot more sort of effort in order to be able to make those changes. But in the meantime, we can provide the foundation, the education, the evidence to help support it, so that ultimately when the window of opportunity opens to make those legislative changes, we can be able to help promote that. And in the meantime, there is generally, an understanding that it's permissible to say that you've had additional training in a specific area. So although we may not say it's a specialty, residency trained in low vision rehabilitation or whatnot. So in this sense, hopefully the CCSO can provide a pathway saying, recognition through CCSO for a particular specialty area. Yeah. And then as that continues to grow in momentum and the evidence and support from hopefully the public and the profession continues to build, then that legislative change can happen after the education and awareness.
Absolutely. And to kind of go back again to this idea of specializing or having additional training, offering specialty services, one of the, when I'm talking to the previous guests in this series, talking about how do we buffer ourselves from disruption and changes in the industry, or how do we make sure that we are the ones that are succeeding or thriving through the changes that are happening. One of the most common things was to offer specialty services. It was to make sure that you have additional training and you're not just doing the standard stuff that's going to, slowly, we all understand that the standard refraction and sale of eyewear is going to, if it hasn't already started to fade as part of our allure for drawing people in for their comprehensive eye exam. Now you get to start to offer other specialty services, myopia management, like you said, dry eye, vision therapy, all these things. If you can offer those things and let the public know that you offer those things, you're going to be able to continue to succeed, from a business perspective, from a clinical perspective. It's very, very important for us to collectively to kind of think about how we're going to continue to offer those services. And I think, again, CCSO being a valuable resource for us as it grows over the years. So thanks for helping to put that together.
I couldn't have said it better. I mean, I'm getting goosebumps as you're describing it, because that's why I think optometry has a really bright future. Like, we can continue to do more and more stuff, and be able to help patients in new and innovative ways. And that technology, that research, will continue to be translated to practice. And this is why I think there will always be a role for optometry. That again, we are that both primary eye care provider, but also as we start to differentiate ourselves, both for patients, professionally, and in the marketplace, there's lots and lots of value that we bring. And I think it's, you know, coming to Canada, or coming back to Canada, it's been fun to sort of see those cultural differences, right? We're very modest, very self-effacing, you know,
Mm,
individually and as a profession, as a culture. And, you know, having been down in the States for quite a while, I relish the opportunity to champion just how wonderful the work is that we were able to do. So,
yeah,
um,
great.
I think that we need to trumpet that more from the
Yeah.
rooftops.
Yeah, we are not good at trumpeting, that's for sure. You know, the time that I love going to conferences, and when I get to chat with my friends and colleagues down in the States, it's amazing to see how comfortable many of them are at, like, really talking about with pride what they do. And you know, and they're good at it, but they're comfortable with telling people they're good at it. We're like you said, self-effacing. We don't really like to brag too much, you know, but we need to start doing that a little more. Let's talk about Waterloo a little bit. Let's talk about the Seeing Beyond 2020 campaign, this big campaign for the Waterloo Eye Institute. I'd love for you to tell us a little bit about what it is, and then, you know, what can we do as ODs, as a community, to support?
Well, thanks very much for the opportunity to sort of highlight it. So the Seeing Beyond 2020 campaign is sort of a once in a generation project. We have a $35 million target. We've already raised $26 million, largely thanks to optometry and the industry and folks. So the outpouring of support has just been incredible. What we're trying to achieve is to really sort of modernize the way that we're able to be a national resource. And so there's three different sort of components to that. One is clinical education and training, another is research, and the last part is with patient care. So from a clinical education and training standpoint, it's a modernization of our facilities to better reflect the way that optometry is practiced. So, being able to now break things out to reflect, so that there's, pre-testing, and the data gathering is less emphasis on that aspect, and more about having the progression into being able to incorporate clinical decision making. Also being able to match that patient experience, so that they actually go through that experience, and not, like it used to be back in the day, where you take a patient back and they spend the entire time in the room, and however long that may be. I think there is a notion that there is more streamlined pathways that can still result in very good outcomes, but not necessarily compromising that experience.
Mm-hmm.
It's important for our students to be able to experience that. So they'll have sort of an integrated way of being able to explore, certainly an increased emphasis on ophthalmic imaging and how that works at the core of all the different sort of services, primary care and specialty services. And then being able to really emphasize and build up those specialty services that provide a unique resource. So along with that are things like teleoptometry we touched upon earlier, and making sure that that technology is available to them, so that they can really be prepared to jump into practice and be able to help lead the way. From a research standpoint, there's going to be a sort of a second floor as part of our 16,000 square foot extension that is going to be a center of excellence. So on the one side, it'll have biomedical research. On the other, it'll have imaging research. So covering the gamut from cell to society. So basic fundamental science of discovery, translational work, and ultimately clinical work as well, so that we really can cover the whole gamut of not just vision science, but neuroscience and the like. So really ambitious plans, where our faculty have really rallied together to be able to identify where we have strengths, and how we can double down and increase that capacity and build out. Along with that is, the ability to partner with the rest of the University of Waterloo. So we obviously have excellent faculties in engineering, math, health, and others. So we can help to shape what that AI might look like, to help build those bridges, build the resources that can help support AI and machine learning research, to build out the ability to now look at big data to help inform not just individual patient care, but population health, and ultimately to inform public policy and decision making. And then last but not least, being able to have, again, state-of-the-art patient care, so that our students are able to integrate and embrace that, and then translating that research into practice more quickly, more efficiently, and ultimately supporting the development of future clinical practice guidelines, helping to support the rational sort of framework for incorporation of new technologies like teleoptometry, and then ultimately supporting that increased depth and breadth, particularly in specialty care. So the Waterloo Eye Institute really is, it's going to be a 16,000 square foot addition onto the existing building. It's going to be a complete sort of remodernization of our clinical facilities, where all of that patient care will take place on the first floor. And again, we'll also have a teleoptometry sort of hub, if you will, a mission control, to be able to recognize that we want to be able to integrate with that as we look towards the future. So it's been very exciting. We're going to the final design, and we anticipate being able to go to construction and tender late this year or early next year. And so we are hoping that folks are as excited about our ability to sort of anticipate where the future will go, that they see us as a national resource. I didn't go to Waterloo myself, so I can relate to those who may not have attended Waterloo. But if you're practicing in Canada, again, there's 2 schools of optometry. And that certainly, if we're talking about education before legislation, if we're talking about research for the Canadian context, I hope that everybody looks to Waterloo as being that support for your associations, your colleges, and ultimately you in practice.
Wonderful. Wow. That is a lot. And that's that is ambitious for sure. That's a word that comes to mind. I like the phrase "sell to society." That's cool. That really encapsulates everything in between. You said it in there quickly, but I know when we spoke before, I brought this up too. I didn't go to Waterloo. I went to New England College of Optometry. Go NECO.
Yes.
Yeah. And NECO asked me for money all the time, understandably, as I'm sure every school does of their alum. And so, I thought, well, I like to donate to the school and my undergraduate school that I went to, to help support the students coming through. I didn't ask this so bluntly, but why should I help Waterloo as well if I'm already? But of course, you just said it. There's so much in there, and I'm asking, facetiously here, why should I? But you mentioned it there. This is, Waterloo's working with our associations and with the Canadian Association, and many of the graduates we're going to see potentially even working in our offices, or our colleagues are going to be from Waterloo. So it's only to our entire benefit overall for the profession and for the future of Canadian optometry. This institute sounds pretty amazing. And again, research is not something I think of often, but it is extremely important, not just in the biomedical sciences, but the technological side, the AI and all of that. So really, really amazing what you're doing there. What can we do then to support? And the other question is, when this is all done, who can come and see it? Like, I'd love to see what I donated towards and contributed towards, and what does that look like?
Absolutely. So first, thank you very much for your support. Again, I do not begrudge those. You always want to support your alma mater, and I appreciate NECO is a great school. I know Howard Purcell, the current president, very well. So that you do, because that's where you cut your teeth. That's where you came from. So yeah, that is absolutely important to do. And I think you framed it very well. So the notion is that you always want to support your school. But in Canada, again, with just the 2 schools, it's important to be able to support us because we support the profession. And that ultimately that can help to support you individually and grow. And again, that those dollars invested will have a tangible benefit, because we have that ambition to really be able to support and be that national resource. It's not just a tagline or rhetoric, that we're prepared to make the investment in time, talent, energy, and resources, and really be able to direct that back to supporting the public and the profession. So in that regard, we're going to have lots of events to be able to help celebrate. So I think we do anticipate having a groundbreaking ceremony, whether it's ceremonial or actual, will depend on the timing, working with the architects and the construction folks. We absolutely welcome everybody and anybody to come and attend our programs, come visit the school, come see, what we're envisioning, and certainly during construction and the like. It really is an exciting time, because it's been something that's been in the making for probably close to 2 decades now, and the ability to come together. Again, I'm really the spokesperson for it, but it's really a collection of folks who've really been dedicated, passionate, and perseverant to really be able to make it happen. And we're closer than we've ever been. And it's really exciting to know that we'll be getting a shovel in the ground. So just to sum, it's, anybody is welcome to visit. We're happy to talk with folks about what the plans are. And we're certainly very, very excited about the potential to really be able to support the profession and to continue all the good works that you all do in your communities.
Amazing. Well, I might want to come by that groundbreaking ceremony. Definitely
Absolutely.
definitely when it's ready, whatever the timeline is, the ribbon cutting ceremony or
You
whatever that
got
happens at that time, I'll be there for that too.
Fantastic.
Exciting, very exciting. Thank you again, Dr. Wu. I really appreciate it. Again, all the insight and for kind of adding your perspective to this very important conversation about the future of Canadian optometry. Any final words on that note that you'd like to share before we wrap up?
I think you're doing really important work. I think it's, again, this medium is not sort of natural to me. Like when we visit, in meetings and things, I'm comfortable doing those kinds of things, but I really appreciate how professional, how polished, and how well you do this. And it's important to, again, help to get that message out there. So thank you for what you're doing. Thank you for, the thoughtful questions and the challenges to, the leaders in the profession in all the different segments. Because it's important that we get that word out there and that we make ourselves available to your listeners in the profession and folks so that they know that we all want to work together. So I can't thank you enough for the opportunity. You were very flattering earlier, but I'm equally humbled and honored to be a guest. And again, I thank you for the opportunity.
That's very kind. Thank you so much. Thank you very much for your time. I know you're a very busy person, so to have you on here has definitely been an honor for me. Thank you, everybody who's listening, watching, tuning in from wherever you are. Make sure you check out the Seeing Beyond 2020 campaign, the Waterloo Eye Institute, see all the great work that's going on there and what they're really ambitiously trying to build. I think all the support we can provide is going to be extremely valuable, and it's going to come back and pay off for the rest of us here in Canada in the future as well. So Seeing Beyond 2020. And thanks again for tuning in to the 2020 podcast, Canada's #1 optometry podcast. I will be back again very soon with another episode. Stay tuned. Take care, guys.